Today is a overview by Ames Bhopal and Arunachal Pradesh, Dr. Tashi and Sonia. Okay, Anuj, go ahead. We should start. Okay.
Thank you, ma'am. Very good evening to everyone. On behalf of my team of CTC 3 from Ames Bhopal, I shall be presenting the progress report for the past year. I hope I am audible to everyone and the slides are visible to everyone. Since our induction into CTC, our team has grown quite significantly. Initially, me and Dr. Vaishali were the doctors in the team in CTC, but now we have, while catering to palliative care patients, we have the support of our faculty, Professor J.C. Sharma sir. Then Dr. Manish Gupta, he is additional professor in radiation oncology. He is also involved in palliative care now. Dr. Sekhar Das, he is also a radiation oncologist and actively taking part in palliative care at Ames Bhopal. Then we have a pediatric oncologist, Dr. Narendra Kumar. He is catering to palliative care needs of the pediatric patients at our center. Then we have Dr. Suruchi Jain. She is a nuclear medicine specialist, and she will, once the department starts catering to these radiopharmaceuticals, then we shall be able to handle bone metastasis in a better way. And the other two doctors that have joined the palliative care team in our institute are Dr. Shobhit Mukherjee and Dr. Seema Moli. They have joined our institute as DM candidates who are pursuing DM in onco anesthesia and palliative care. Besides these team of doctors, we have our SNOs who were already part of the CTC program. Senior Nursing Officer Ravesh Kamal and Sunita Solanki. They are coming handy in catering to the services. Besides, there are many more people whose names have not been included. They are mostly our junior residents who are making a big difference in catering to palliative care services on ground. As far as the palliative care services, yes, since this format was given, we have incorporated the responses in this format only. We have started the palliative care services, outpatient services at our institute, yes. Then we have a standalone palliative care OPD, yes, we have. Since 2017, we have been running the palliative care OPD, but before induction into CTC 3, the things were, now we can assess that the things were earlier not up to the mark, both from the patient care point of view as well as from the point of view of record keeping. So although we started in 2017, but major changes have happened after our induction into CTC 3, that was in 2019. Number of patients, although they are on the lower side, but can't assess the numbers with the ongoing pandemic situation. Number of patients that we are treating, new patients that we are treating per month are approximately 10. Then number of follow-up patients per month, we are treating approximately 10 to 12. In the later part of my presentation, I will be briefing about why these numbers are not, why these follow-up patients are not much. Then yes, we have started palliative care in service, inpatient service. Yes, we have started, and consultation services. We are actively involved in catering to the consultations that we receive. Then date of starting IPD services, again we started in 2017, but as told earlier, they were not up to the mark, but now we are gradually improving. Then number of consultations and IP consultations that we get is approximately 10 to 12 per month. Then as on the morphine availability aspect, yes, we have ensured uninterrupted supply of morphine, and the date the oral morphine became available in our institute was from October 2019. Then amount of morphine procured in milligrams per month is because of the licensing issue, we are facing this problem that we want more, but because of the capping capping due to the license, we are not able to get. So approximately 1000 milligrams of morphine we indent. Even after rationing, we require 1000 milligrams of morphine per month, but we are able to procure only 250 to 300 milligrams. This bottlenecking is likely to get removed in the coming time, because the paperwork has already been done. But just because of the COVID related problems, the machinery is the state machinery is busy with the COVID related work, and probably this aspect is getting a little bit neglected. So in coming 1 to 2 months, this problem of discrepancy between indent and the procured quantity would definitely come down. Then amount of morphine used per month, since we are getting less, we use all the morphine that we procure. Then type and strength of morphine. At the moment, only immediate release 10 milligram preparation and injectable 10 milligram per ml preparations are available. And procurement of 30 milligram sustained release tablets is in the process and likely to materialize in coming 2-3 months. Are other type 3 opioids available? Yes, fentanyl injections are available. The fentanyl patches are not available with us. Amount of so in palliative care patients, we have not used any other step 3 opioid other than oral morphine. Step 2 opioids are also available in the form of injectable tramadol and oral tramadol also. Then have you advocacy regarding advocacy and training services? We have done a bit of advocacy services and sensitization services, but we have been hit hard by COVID, since we were in the very early stage of our the growth. The COVID has hit hard in our progress. We have not been able to conduct the LNEC course. This LNEC course everything was set. We were in close touch with Sister Hanife for conducting this LNEC course in March 2020, but just a fortnight before the conduct of this course, this COVID-19 situation worsened and the lockdown was imposed, so we could not proceed ahead. And that situation has still not normalized. So we are planning to conduct this. There is a lot of enthusiasm among the nursing staff to do this LNEC course, and we are also enthusiastic. Only the ground situation needs to improve a bit, and then we will just go ahead with this program. Then similar is the case with IAPC program. IAPC program, we have talked to a few doctors in our department as well as in the allied department, and they are also looking forward to doing the IAPC course once it is conducted in Bhopal. So have you conducted any in-hospital sensitization? Yes, we have done. The list will be presented in a little while from now. So this here comes our list of advocacy and sensitization services. Most of them have been in the form of lectures and workshops. So in 2019, on World Hospice Day, we introduced the concept of palliative care to the nursing officers and senior nursing officers of AIIMS Bhopal and residents of junior residents, senior residents from anesthesia, as well as from the allied departments who cater to cancer patients. Then another lecture, priming lecture about pain management in cancer patients was delivered to senior nursing officers, and it was attended by almost 30 nursing officers, senior nursing officers from various departments. Then in 2020 World Hospice Day online guest lecture, it was attended by our, our residents and consultants from radiotherapy, oncosurgery, and this lecture was delivered by Seema Rao ma'am and Rupesh Sen sir. Then workshop on palliative care under the CLEAN project. This is a CLEAN project which is going on in our institute, and it was attended by 65 nursing officers from all over the country. So it was a whole full day workshop, and another workshop, a 2-day workshop was planned in 2020, but the whole CLEAN project could not be initiated in 2020 because of the COVID situation. Then lecture by Naveen Salin sir and Rupesh Sen sir. It was attended by 60 paramedics and medics from in Bhopal. Then another lecture was delivered in the second World Congress of Pathology and Cancer Diagnosis by Vaishali ma'am. Then recently we conducted a workshop in which under the National Palliative Care Program, the state government sent the 51 nodal officers from 51 districts of Madhya Pradesh to get a basic training in palliative care, and they made AIIMS Bhopal as the training center for them. So recently we conducted a workshop in which 51 medical officers, all were senior medical officers who were to become nodal officers for delivering palliative care on ground in the district hospitals. So it was a big success for us. Then in 2020, a big hurdle from manpower point of view was overcome when we started the DM in onco anesthesia and palliative care program. Then end of life care, this was a very interesting workshop that was about to happen, and esteemed a panel of doctors from very renowned doctors and advocates was about to happen, but it was the basic theme of this was end of life care in ICU. So this program just got cancelled 12 hours before the program scheduled program because of the worsened COVID situation. This was a very interesting program for which I was the nodal person conducting this workshop. Then LNEC was, as I told, LNEC was cancelled at the last moment. So you can everyone can see that we were hit quite hard by the COVID situation. As far as difficulties in starting services in OPD and IPD, we are facing some practical problems on ground. First and foremost is we do not have a medical oncologist till date, and only one oncosurgeon in our institute. So everyone can understand that this is a real problem. Then another problem that we are facing is that state government, there are a lot of state government empaneled hospitals that are catering free of cost to cancer patients. They right from surgery to chemotherapy, they are delivering everything free. In our institute, the chemotherapy is still not in the routine pharmacy free of cost. So a lot of patients go away from AIIMS to the state empaneled hospital for their cancer treatment. So that is another reason that is impeding our progress. Then lack of dedicated staff. This is in fact the most important hurdle that we are facing. And the COVID situation has actually worsened it. We have two senior nursing officers, and they are in charge of high priority zones of the hospital. Like Ravesh is in charge of medical education. He is the only person in that particular department. and Sunita is in charge of gynecology ICU, and so that is also uh, a high priority area. So at times they are not able to cater to the time of need of the hour. So that is one problem, and that is one reason why we are not able to conduct sensitization activities on a frequent basis. Then awareness among palliative care, yes, we are overcoming this problem. Palliative care is a relatively new branch, and uh, 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 this awareness among fellow doctors is concern at the moment, but we are gradually overcoming it, and the results have been quite encouraging for us. The initial, since we are in the very initial phase of our the institute is in the very initial phase, so certain teething troubles are there, and that is in every sphere. Then whether it be need to upgrade, because the focus has been on more essential services, palliative care has not received that much importance uh, from the administration as we would have liked. Then OPD space is a problem everywhere. All the departments are facing this OPD crunch, so OPD space crunch. So are we. Then pharmacy related and procurement related issues are there, which probably in time to, but they are beyond our control. So we have stopped thinking about these issues, and we are happy with what we have. Administration, another important problem that we are facing is, Sushma ma'am can help us here in this aspect, that the interpretation of the license, interpretation of the license is a problem that we are not able to convince the administration about. They tend to take the limit of the license amount very seriously. And to start with, we had a license amount of only 700 tablets, annual quota of 700 tablets. Then we upgraded it to 2,000, although we wanted to upgrade it to 5,000. But again, the administration was skeptical that how can you just jump from 700 tablets to 5,000 tablets? So that requirement was cut down to 2,000 tablets, and even if we consume that 2,000 tablets, the procurement becomes a little problem, that the administration starts saying that you have already consumed your annual quota. How are you going to procure? We will not allow this procurement because the rules rules they are interpreting the rules quite seriously. We tried to get a clarification regarding this from the state drug controller also, but the state drug controller also to the pharmacy person who went to clarify this issue, the state drug controller also said, yes, this license amount is binding, and you should not exceed this amount. So that is one problem. Although we know that this interpretation on the part of the administration as well as the state drug controller is faulty, and we need to rectify it. In this case, Sushma ma'am can be of utmost help. Then difference in opinion regarding this is the same problem. Then COVID-19 related disruption of services has been a problem that we had just started to gain pace, and then COVID struck 2 times, and we were down and out. We are again building up our patient base, and we are getting very good response. Most of the follow-up are this is what I wanted to tell, that because of the limited amount of morphine, in order to maintain continuous availability of morphine in our institute, so that at any given point of time we do not run out of morphine completely, we have licensed with another palliative care doctor who is also an anesthesiologist, not at AIIMS Bhopal, but he runs the NGO, and he has got availability of different formulations of morphine. So we send most of our patients for follow-up, not for follow-up, the patients follow up with us, but for procurement of follow-up morphine, we send the patient with very clear instructions so that the patient does not, and we give a call to the doctor also, so that this procurement of follow-up morphine is quite easy for the patient. So on that aspect, we are not facing much problem. Although we would have loved to give the morphine, even the follow-up morphine, from our hands to the patient, but we are managing that aspect also. Then, as far as difficulty in procuring opioids is concerned, interpretation, as I told, that interpretation of the annual quota has been a problem. Then apprehension regarding getting persecuted if annual quota is exceeded, that is another problem. We from time and again we have presented documents to the administration, but somehow we have not been able to convince them. Then another problem that we face is that there is no mechanism of morphine dispersal through in-house pharmacy against payment. So what we are doing at the moment is that the central store procures morphine from the vendor. We indent the morphine from the central store. We keep it under our custody, and for any patient, whether on a OPD basis or on a IPD basis, we disperse the patient the required amount of morphine free of cost. But we can understand that this cannot be a long-term solution, because at the moment our morphine requirements are less. We are able to manage the record. Once this requirement goes up, consumption goes up, it will get difficult to manage the morphine records on our basis. And again, another problem that we will face is the financial implications that are coming to us. So we are trying to get the in-house pharmacy to keep morphine and procure a license for its dispersal, but they are reluctant to do it. Amrit Pharmacy is the in-house pharmacy. They are absolutely reluctant in getting a license and dispersing morphine. So again, some help from the higher authorities is needed in this aspect also. Then lack of trained staff in pharmacy. Our staff is outsourced, and probably he is not much aware about essential narcotic license issues. Then mismatch, as I told, that there has been a mismatch between the indented and the supplied quantities. Hopefully this thing gets rectified in future. Then specific challenge due to COVID-19, nothing specific. Almost everyone has faced the same problems that we have faced. So I will not talk much about it. Then lesson learned during the past year. Yes, on a personal basis, COVID-19 was distressful as well as enlightening also. It gave us time to introspect about about the fragility of life, and it changed our perception towards the suffering of the human beings, especially cancer patients. Personally, COVID-19 has helped us to mature as human beings. The interdependence of various sections of the society was understood. When there was no help when there was lockdown, so only the neighbors could help, and the help was pouring from very unexpected sections of the society. The need to create a better atmosphere for terminally ill patients was constantly felt during the COVID lockdown and COVID surges. Then professionally, interpersonal communication, all of us improved as in interpersonal skills. Then importance of teamwork was acknowledged from time and again, because COVID has taught us that only teamwork matters. No individual stands anywhere in front of a good teamwork. Then as far as interesting story is concerned, yes, we have an interesting story to share. This was a 37-year male who had suffered a cardiac arrest while he was awaiting a surgery for tracheal stenosis. His tracheostomy tube got dislodged or whatever happened. We got the patient with the ENT team resuscitating the patient. He got resuscitated, but while being in arrest situation, he suffered a severe brain injury and he was brain dead and was in the ICU. His younger brother and father were taking care of him, but were not aware about the futility of the treatment. They were still hopeful that yes, his patients would improve. After waiting for about 3 to 4 days, and after getting a specialist consultation with 2 or 3 departments, we conducted a family meeting and were able to convince them about utility of the ICU treatment and were able to convince them for organ donation. Although because organ donation, we convinced the patient relative for organ donation, but it could not get materialized because of logistic issues. But at the patient's end, the relatives had a consolation that certain, and after coming to know about the short-livedness of his member's life, they could finish certain pujas and also they were quite satisfied that डॉक्टर आप लोगों ने समय से बता दिया, तो हम लोगों ने ये चीज कर ली, कुछ some certain paperwork was to be done, so they could do it, and we also felt satisfied that we could help the family take decision for life support withdrawal, and we successfully withdrew life support system and could end the patient's suffering and the relatives suffering to a certain extent. The way forward, making others feel the need for palliative care through perseverance, persuasion, and sensitization. This is the only way forward that we could gain from our experience as well as from the experience of others working in the field of palliative care. So these are a few slides, photos with Vishali ma'am taking sensitization lectures. Then this was another sensitization activity in which residents from our department, nursing officers, residents from surgical oncology, they participated. Then this was an online program that we conducted. Then this is Sushma ma'am interacting with us in the recently concluded workshop in which we trained the NHM nursing officers, NHM medical officers for symptom management and safe handling of opioids. This was our team. This is our PMR, associate professor from physical and medical rehabilitation, delivering a lecture on lymphedema care. This was the lecture, this was the auditorium in which the lecture was happening. Then this was a very interesting role play done by psychiatry department. These two doctors here are from this, these are residents of the psychiatry department. And over here, the three people, these are the nursing officers. They did a fantastic job and did a very nice skit for the patient. This skit was regarding patient communication. Communication skills in palliative care. So this was appreciated for the audience, liked it a lot. This is our psychiatrist delivering a lecture, delivering the excerpt from the skit. So that is all I wanted to share. With this, I come to the end of my presentation. thank you everyone for listening.
Congratulations, Anuj.
Pardon
Congratulations,
me?
Dr. Vaishali. Can you hear?
Yes, ma'am. Yes, ma'am.
Yes, very good. So, within no time, in spite of a lot of constraints, I think you both with the team is doing fantastic job. So many activities you have already done. So many so many people, so many departments you have already roped in. Physical medicine people, psychiatry people, they all are coming forward to make a team with you. And I
Yes,
don't
ma'am.
think that there is any issues, but I can see that why this morphine availability is becoming an issue. So I just right now we will go for the next team. I just want to know one important question, that who is doing this in your miss, who is the person whom should I contact so that this problem will get solved? Only with director or anybody else is preventing you to use
Ma'am,
the morphine?
actually, should I tell here on this platform, or should I tell you personally?
Okay, if it is something confidential or which should not be disclosed, tomorrow you can, or after the meeting, you can tell me. I will talk to the director directly, because
Yes,
there
ma'am.
is no way that there should be a limit that, and means like government of India is making rules, state government is making their own rules, and your hospital administration is making another rules. I don't think
Yes,
that
Mm.
this
yes,
is
ma'am.
absolutely wrong, absolutely wrong. So
Mhm.
this means they don't know anything about the opioid medical uses of opioids. So we
Exactly.
will have a meeting. I will talk to director, we will have a meeting. Those who are preventing or and obscuring your way, I will organize a meeting with your director, with all the people, and we will sort it out immediately. Don't worry about it. This
Yes,
will
ma'am.
happen in this next week definitely. So you
Yes,
should have
yes.
told me this before. Anyway, so but otherwise I think you are doing fantastic job. Anybody wants to comment, Dr. Cynthia Naveen, that were the progress of AIMS Bhopal? I think I'm really happy that even they have trained almost all MP nodal officers, and I attended that meeting and everybody was so enthusiastic and talking to it's like so many people they have and there is a big concern that they are basically again an anesthesiologist, and they are full-time anesthesiologist. So as always, they are giving their extra time and they are working very hard. Naveen, go ahead.
Yeah, thank you, Anuj, for a very detailed presentation. And I have visited AIMS Bhopal, and the level of commitment by the AIMS Bhopal team. Am I audible?
Yes, sir.
Yeah.
You are very much right.
Yeah. I think you have done a phenomenal job, considering you working at both sides, that is in anesthesia and in palliative medicine, and also within the pandemic situation. I just feel that there is a huge scope probably for improvement in terms of, I think your next scope should be starting MD program, where many AIMSs are looking at. I think that's something, if you are able to do that, I think all your problems will get automatically solved.
Yes,
Yeah. And I think there's a huge potential for you to start the program. Yeah.
sir, our institute is at a watershed moment. Matlab in coming 3-4 months, things are going to change drastically. That is my perception. And that all those things will be for better.
Yeah. All the best for you. Yeah.
Thank you.
Thank
Thank
you.
you.
Thank
Dr. Vaishali, you want to say something? We will go for the next.
Only regarding the opioids, madam, that you already promised you will talk to our seniors or whatever committees are there. Like Anuj has already mentioned, the narcotic committee, which is headed by the psychiatry.
It is
So
so funny.
that is the only things, like if we
Everybody
have
is
to
making
send.
committee. Your hospital has made
So there
another
are,
committee.
so even if we are trying to explain or clarify the things, there are multiple committees. Like then pharmacy people will tell you know that committee is, madam, you have to explain to them, and like that. So there are many hurdles, but we are trying, madam. But if you can speak to them or we can arrange some meeting, then I think it will be.
Of course, 100%, 100%.
So that
Otherwise,
is the
I
only
will
thing,
call
madam, which is.
everybody over here. Okay,
Yes.
no problem.
Okay.
Dr. Cynthia, you want to say something, and
Yes,
Tashi will present the next.
I want to congratulate your team I think the obstacles that you're facing is huge, you know, in a new institution and all of this. So, you know, what you have achieved is amazing under those circumstances. May I ask you, are the pharmacists your friends, or they are people that you need Dr. Shushma to work with also?
Madam, actually, they are changing every 3 months, 4 months. They are changing. So whenever we explain that faculty is changed to some other committee, so that is again one issue. Like they are not permanent people, and the pharmacist is not permanent. They are all contractual people actually.
Oh.
So yeah, these are the issues. But if Madam can, we'll arrange one meeting with these, people and.
Yeah.
You don't have to arrange. I will arrange tomorrow. I will talk to director
Yeah.
in the morning, and he
Okay.
will arrange a meeting for you. Don't worry. Okay.
And I think you continue your sensitization of all your colleagues. I think they're doing a great job there. If they're changing, you just have to keep on, you know, educating and re-educating, and make them friends. You know, I think confrontation is not good. So the psychiatrists, the pharmacists, and all that. But you know, we're all cheering you on. These are obstacles that you're facing, and Dr. Shushma is going to help you get to the very top and see what she can do there. So congratulations.
Thank you.
Thank you. So next team, Tashi and Sonia, please. Congratulations, Vaishali and Dr. Vaishali and Anuj.
Yes.
Hi, Sonia.
Hello, good evening, ma'am. Ma'am, should I share my slides now, ma'am?
Yeah, please.
Sonia
Share
will be
karo,
presenting
karo.
one today. My net is not
Eagerly
so
waiting.
good that I've requested Sonia.
Yeah, sure, ma'am.
Okay, no problem.
Okay, ma'am. Good evening to everybody. So today I will be presenting our progress report. So now coming to this, the current committee composition, August 2021, 2010 to July 31, 2021. So till now we have only two. Previously, one sister was there, but she has been transferred out. So only Tashi madam and I are in the team. Then coming to starting of palliative care OPD services. So we have started our OPD services in the month of November 2018. Since then, we have been going every day. We are open OPD services except for Sundays and holidays. And per month, we see almost 100 patient per month. And number of patient, what we see new patient is approximately 4 to 5 in a month. And the next
It is
is
reduced due to the COVID. Actually, we before numbers were more. This year it is reduced to 4 to 5.
Yes, ma'am. Previously, the numbers were quite very good, in fact, but because of the COVID, after say 2019, 2020, it has reduced to approximately 90 to 100 patients per month. So whether we have started any in-service services or not, yes, we have started. We have started admitting patients in the ward. Ward is like it is only for the palliative patient, but it is for the whole general patient. Even the surgery patient, medicine patients, all the other department patient also, they are admitted in the same ward. And in a month, approximately we admit 4 to 5 patients a month. So next comes uninterrupted supplies of morphine. So yes, we have an uninterrupted supply of morphine since 2019 January. Till what we have in our department is 10 milligram. We have 30 milligrams sustained release, and we have 10 milligram per ml injectable morphine. So far, we have purchased 45,000 number of 10 mg tablets, and 10,000 number of 30 mg sustained release tablet, and 400 ampoules of injectable morphines. And per month we are using, at present we are using approximately 1,000 to 1,500 tablets per month. Before COVID, we used to dispense approximately 2,500 to 3,000 tablets per month. But after this COVID, many patients we have lost to follow up and they have not turned up. So the consumption has also decreased a little bit. And type of morphine availability are 10 mg in immediate release, then 30 mg sustained release, and then injectable morphine. Now coming to the step 3 opioids. Apart from morphine, we don't have step 3 any opioids. But like in the pharmacy, the private pharmacy, we have made it available that fentanyl patches. Whoever can buy the fentanyl patches, we prescribe them. And then apart from that, what we have step 2 opioids, we have tramadol in injectable form also, and we have in tablet form in 50 milligram tablet and 100 milligram tablet we have. And next is, have you conducted any palliative care training? Till now, we have not conducted any palliative care training, but very shortly, since 12 districts are approved for palliative care, the centers from 29 districts in Arunachal Pradesh. So we are planning to conduct very soon. And then next is, have you conducted any in-hospital sensitization program in palliative care? Yes, we have already done 2 sensitization program in our hospital. And one is this one-day orientation program for doctors and nurses of our Papumpari district. And next was the sensitization workshop for the district, for doctors of all the district in Arunachal Pradesh. And then numbers of nurses who attended those programs were 25 to 30 numbers of nurses, and doctors, it was 120 numbers of doctors, and other than paramedicals and the other staffs, there were 10 numbers. Now coming to any advocacy, our newspaper interviews. Yes, we have done advocacy, this workshop at RGU, that is Rajiv Gandhi University, for the students of social work department. And the strength of students were approximately 50 to 60 numbers of students were there. That includes not only the social work department, but other department as well.
Teachers were also there.
Yes. And then next comes the challenges. Since we have not faced any challenges in starting any OPD and IPD services, and till now, what challenges we are facing is because of the COVID situation. Because of the COVID situation, the situation has gone all haywire. Because of the transportation, many of our patients, they are not able to contact us. They are not able to come to our district because they are staying in a very far-flung areas also. And
all of them gone back to the districts.
Yeah, most of the patients, they have gone back to their district because of the fearing of this COVID-19 infection. So that is one big problem which we have faced during this period. And because of the lockdown, there was a complete shutdown. So many patients, they couldn't come to our center. Next is this lesson learned. Personally, what I and Tashimada, what we have learned is nothing is permanent, and life can go haywire anytime. And what matters is help someone who needs your help. And personally, professionally, we have become more empathetic and compassionate towards the patient and their caregivers. Organizational, what we have learned is that teamwork really matters, and teamwork makes things easy for us and give better care to the patient. Now coming to this interesting stories, we have many interesting stories because every patient that when we deal, they become the story. So we don't have particular as such stories, but all our patients.
Who has lost? It's me who has
Sorry,
lost.
ma'am. Actually, I was disconnected, ma'am.
No problem. I just thought I have disconnected. Okay, go ahead.
Yes, ma'am. Okay, ma'am. I'll just. Now coming to the stories, as I said that all our patients, they become story, and everybody is important to us. So I'll just show you some clips or photographs. This is the first one. We have a dedicated OPD in the Tertiary Cancer Center. And here I and Dr. Tashi Madam, we are just standing outside our OPD. And next photo, we are showing this one-day orientation program for doctors and nurses in the Humpare district. So many doctors and nurses have come for the training. And then next is this workshop, what we have done at Rajiv Gandhi University. It was organized by the Social Welfare Department at RGU, that's Rajiv Gandhi University. It was basically for cancer and palliative care scenario in Arunachal Pradesh, for which we have attended as a resource person. And next photo is the sensitization workshop for doctors and nurses of all the district in Arunachal Pradesh. It was a very mega event where Susma Madam and Cynthia Madam and Alok Mathur sir, they have come here, and it was a grand success actually. And here we have all the doctors, maximum doctors from districts, and some sisters from district, they have attended this training. And after this training only, lots of people, they have come to know. They have come to know that, okay, we have a palliative unit in Tertiary Cancer Center. So many of our, this doctor colleague and all, they have started referring patients from very far-flung area just to control the cancer pains. And apart from this, not only cancer patients, but we are also taking care of non-cancer patients like from the other department. And recently we also have one patient who is under morphine treatment for diabetic leg amputation. So next is we have also started home visit. It is on our personal interest actually. I and Tashi Madam, whenever there is any need for the patient, when the patient is bedridden, and if he or she really needs that services, we just go on our own and then visit the patient. And very recently we have visited this boy. He is a 17 years old boy with sarcoma who was
Ashi, I think you are muted. Sonia, you are muted.
She got disconnected.
Sonia. Okay, so you can go ahead, Tashi. You can only speak whatever. Next, continue.
Yes,
If you want to add something.
We do on a need basis, and whenever we feel that the patient cannot come and it's bedridden and it's nearby, we visit. It has become a daily routine for us for 2-3 days. We have been visiting 2 patients as of now, but this boy, when the one she is showing has just passed away day before yesterday. We have one more patient with us now. We do the home visit and we give phone consultations also. Ma'am, you are muted. We can't.
Sonia, are you back? Sonia, वापस आ गए? Are you? Sonia?
Yeah, she's sharing.
Ma'am, this is the first photo is of home visit, and the next photo is we have started our own this outpatient daycare services in our hospital with 4-bedded. So now we are planning to make it a state-of-the-art this palliative care unit. So for that we have already moved a file, and it has been already
approved by the government, and we are going to purchase the things. We already have got the beds.
Sonia is again muted.
So that was the last slide, ma'am.
Okay, then thank you very much. As
yes,
yeah, we can See, we can see your home care visit. Yes.
Home care, and this is the 4-bedded, we have started daycare unit in the tertiary care center. So it will be well equipped very soon. We have, government has approved the things. It's on the stage of buying on.
So what is one important thing which you think that is the biggest challenge in your practice?
We have very shortage of manpower, ma'am. We don't have a sister. And the home visit is, I don't think it will be possible for some time because of the manpower and also because of the terrain. We are able to provide only the nearby areas, just near the hospital, those patients only. Otherwise, we don't have such problems, ma'am. Our medicines and all are this thing, uninterrupted supply we have. And we have got this thing, cooperation from all the officers also in the government.
It's really encouraging to see Tashi and Sonia your progress, that you are doing such a great job, and it gives us also this it gives us very, it's like encouragement that the work which all the faculty members are doing in CTC program, I think this is giving fruits, and people are working hard to develop palliative medicine in their own whichever way possible, and not a single, I can't say that this model is best and that model is best, but everybody is trying their best. So whatever with their available infrastructure. So anything, Dr. Naveen and Dr. Cynthia, you want to add? Or anyone wants to add for both the centers, because I am really encouraged to see their progress, both of them. Yes, Dr. Cynthia. Go ahead, Naveen.
Yeah, I think they're doing an excellent job. I just thought that the mentor of this also, I think last time also we had a discussion about this. They have a lot of constraints in which they work, and especially the human resource constraint, whatever they are
Yeah,
having.
sir. And this whole 1 year I was doing anesthesia only. Government had asked me to do anesthesia. I was doing anesthesia. We were not able to do the palliative care this whole 1 year. Again, I have come back. Again, we are picking up now.
Yeah, because all the
Whenever
other,
there is shortage of anesthetists, so they call me. So I can't deny.
yeah, all the other things could be brought together, but human resources where you are able to give.
I have written to the government also, sir, for recruitment of sisters and sanitary assistant. The file is moving around.
Okay.
So I approached the government for
That's
that.
all I had to say. Thank you.
Yes, I was so happy to see both of you, because actually the very last time I managed to travel was to come and visit you
Yes.
before COVID, and I've been locked down since then.
Yes.
So thank you for showing that photograph and giving me those very happy memories of seeing you. And I'm so encouraged to hear that what you have been doing, because I know, Dr. Tashi, they've sent you out of the district during COVID early on, and now you're back, and now you've lost your nurses. I mean,
Yeah.
These are tremendous barriers, obstacles that we face, but I don't think they are completely abnormal obstacles. I think many of us face very different sort of obstacles, and of course you have COVID as well, which sort of makes everything 100 times worse. But thank you for carrying on. Things will improve, and we hope that the next time we catch up with you, the two of you will have happier stories to tell us about your team and things like that. But so encouraging that both of you are carrying on. So please do carry on.
Thank you, ma'am. Thank you so much.
So anyone else wants to add something? Seema, do you have any comments for both Sister Hanife, Seema? Anyone else? Anyone wants to, who is getting encouraged and seeing I really am overwhelmed to see the progress, the way they are progressing.
Yeah.
Seema?
Yeah, so initially Charu and myself had gone to visit them initially as mentors sometime when they started off with in 2019, and things were all put in. They had a very supportive administration also in terms of encouraging them. I think the COVID, yes, as it is, it's a very difficult terrain there, and the manpower itself is very less in the hospital, though the intentions are there, but the trained nurses, they had difficulty finding at that time also, and I'm sure COVID added to that difficulty more. And I guess now with things settling down, they are back on track.
Yes.
Probably they lost a year in between, but mostly they are back on track now. That's good to see. And I think most also of important is the connection they have with the one of the teams in CTC4 also, isn't it?
Yes.
Yeah. So I think that was the positive aspect of them coming for the CTC3. They were able to get in more teams or more hospitals from Arunachal Pradesh into the CTC training. So hopefully that will continue. Yeah, that's all I had to say from my side.
You
Thank
have
you.
a very helpful nodal officer, I remember. Is he
Yes,
still around?
Yeah, he is there, ma'am, and we have an NHM National Health Mission Director also. He's also very supportive.
Hmm.
So anything we ask from the government also, they are very supportive. We don't have obstacles as such from the administration.
And
So
it's
you-
wonderful to hear about your morphine supply and all of that. That's really good.
Yes, ma'am. We have uninterrupted supply,
Hmm.
so that's not a problem for us.
So Tashi, if you will ask for the some number of nurses for your palliative care program.
Yeah, ma'am, I have already asked the mission director and he is into it. We have already moved the file. It's with him only. He is trying to do that, ma'am. Or maybe we will be training more sisters. That's only we can do. Those who are already in the job.
So
It's
we can
on
plan
the-
it properly. We can plan it properly, Tashi, that we can train 50 nurses, for example, for whole of the states initially. Sister Anipe and team will come over there, or then I think they can spread over various parts, because there is one more team from Arunachal Pradesh. We will talk
Yes.
about this.
Yeah,
Definitely. As today, Sister Anipe came to me and she discussed me about the scarcity of nurses at various CTC centers. So we are also planning to take the sponsorship for appointing nurses for CTC, at least CTC centers. So we will be working on that also. That
Yes.
we will request somebody to
In
appoint
the
at
ward
least one
also
or
we
two
have
nurses.
trained verbally, and I have asked many sisters to join the trainings in Trivandrum Vala course also. Many have tried to join, but only 2 or 3 they have finished the courses.
I
So we
think
are trying
sending
to
your
do.
nurses, rather than sending your nurses, I think we can send nurses from here and they will
Okay.
train the nurses.
That will be
Maybe
very good, ma'am.
over the
Yeah.
period.
We can tie up with the government and we can again
Yeah.
arrange a workshop 1 day or 2-day workshop. We can do that, ma'am,
So
if you can arrange that. If the trainers
we
from
can
there.
arrange that. We can arrange that. So we will talk to the mission director, designate few number of nurses, and we will send nurses from here and they will train your nurses over there. So I
Sure,
think
ma'am.
that will be a
That will be good.
Yeah.
So I think our time is over, but yeah, Hanifa sister, please go ahead.
Oh, nothing really. I was just going to assure Dr. Tashi that we will come to Arunachal.
Thank you,
And
ma'am.
we have had a few nurses from you already who came to Guwahati.
Oh,
But
yes.
I think those nurses are gone now,
Okay.
or I don't know if they are still there. But Arunachal is very much in the plan. And we are trying to join 2 of you together somehow.
Sure.
And I will be in touch with you, and we will do it actually shortly
Thank you.
before Losar coming.
Sure.
Okay,
Sure.
I think
Thank,
we'll do that.
thank you, ma'am.
Okay, so our time is over. I think everything is very encouraging. Don't you think, Dr. Cynthia, Naveen? Everything is encouraging. Only one thing is discouraging me, that is number of participants every meeting. And I am going to send one message to all the participants today only. I will draft when I will, before sleeping, I will send to everyone. And this should not happen, because they should attend the progress of other centers also. Then only they will get encouraged. Otherwise, they will not get inspiration. From where they will get an inspiration? When they will come to AIMS, they will get depressed that how can we create such atmosphere? How can we create such manpower? But the way people are struggling, this is a point of encouragement, because they have not seen AIMS when it was starting, but now they have seen when it is fully developed center. So I think this is a thing which is discouraging me, that only 23 participants. There we were having 28 just now, few minutes back, but now it's only 23. So we will make sure that everyone should attend this to see the progress of others. I think this is important, but otherwise it is quite encouraging. I think whatever we have done, don't you think, Naveen, that institution, the the perspective of palliative care is changing now. Everybody is not only just uh, it's community based, volunteer based. I think we are coming out of it, and now it is becoming more and more. Institutions are coming, they are participating, they are. And yesterday we have seen that there was one webinar by Karunacharya, Seema, and Naveen and Dr. Nagesh has organized, and they have called all CTC centers, and it was so good that every CTC center was doing so well in their integration of palliative care in intensive care, and everyone was acknowledging CTC program. So it was a it was so encouraging that with CTC program they got trained, and they have come to know that there is something called integration of palliative care in ICU. So I think, Dr. Cynthia, it is, everything is giving a lot of fruits. And one very good news I want to share, that I told you that Diploma National Board has approved DNB palliative medicine, and I don't know how many centers right now. Today I don't have information that how many centers have approved, but that the information which I got today, our two CTC center have got approved for DNB program, that is Gangaram Hospital and Praneeth's Hospital. And I can see that Praneeth is also not there. So tomorrow only, Praneeth, you are here or not? So he is not eligible to become palliative medicine teacher if he's not there. So today only I will call him that he should attend all the sessions, like he should not miss, because every session we get something to learn. And but it is a good news that two CTC center, I think Dr. Mithilesh and Dr. Rajesh is here. Dr. Mithilesh is also not there. Dr. Bimla is also not there. They have just
Not joined through Facebook, ma'am. They've never joined through the Zoom. Mithilesh and Dr. Bimla. When we do the live, they join through that normally.
Okay.
Madam, what about other centers where DNB, is it
I
coming
really
in
don't know.
parts?
I don't know. I really don't know. I was thinking about the Gayatri and all, they will give the information, but I will inform. I am just waiting for 1 or 2 days more, and then I will speak to them that what has
Because
happened.
even there is, if Dr. Raghavendra has also is a CTC center.
Who has come to check? You went there, na?
Yeah.
I will
Raghavendra,
speak.
Gayatri. I think they must be doing as per they are getting the reports, or I don't know how they.
Maybe
Yeah.
maybe today they must have sent. I will wait for 1 more day, and then I will speak to them.
Yeah.
Okay.
Okay, ma'am.
Okay, then thank you very much, Dr. Vaishali, Anke, Anuj, Sonia, Tashi, and thank you everyone. Thank you, Anipe and team, Nilima sister, for I think you are also biggest source of team building this LNEC program, And
Thank you.
thank you, Seema. Thank you, Naveen.
Thank you.
Dr. Cynthia, bye. Thank you very
Thank
much.
you. Yes, lovely to see everyone.